On this episode of RPA,
I've got COVID.
a routine checkup for Theo
I've got a CT scan to check my lungs.
uncovers an incredibly rare tumour.
Roughly about 1 in a million.
1 in a million.
Yeah.
Now, the race is on to remove it.
We may have to sacrifice this nerve to get the whole thing out in one piece.
It's another busy day in ED,
Okay.
but Big O for falling from the sky
What's the surface like that you landed on?
Concrete.
Concrete, okay.
isn't the only surprise.
It's the worst one. Spinal web.
And after marathon surgery, doctors hoped Jolene was in the clear.
Does that keep coming out?
Yeah, it's sort of continuous.
But a lot can change in 24 hours.
400 in an hour, that's way too much, so we have to take it for urgent surgery.
During a routine scan after contracting COVID, a tumour was discovered in Theo's chest. He and wife Jo are meeting with Dr. Chris Kao to see what can be done about it.
Most of the time when they come and see me, fear is a very common emotion. And most of that fear is due to not really understanding what's going on, but knowing that something terrible is going in their body.
Now, my understanding is that you saw Professor David Barnes, is that correct?
That's.
Tell me a little bit about what brought you to his attention.
I got COVID and Dr. Barnes was looking after me. I've got a CT scan to check my lungs. And once they got the results, they told me I have a lesion. I was breathing normal, you know. So there was, I didn't even, nothing.
The lesion that we're talking about is the size of a small fist, 7.5 centimeters. It's right on top of your heart and your major vessels coming out of your heart. So if you like, I can show you what it looks like on the scan here.
Sure.
This is your liver, this is your left lung, your right lung, and your heart. What doesn't belong to this picture is this lesion right here. You see that?
Yes.
Yeah, so we don't really know what it is, but we do know it's abnormal, and we do think they should be resected.
Which means major surgery for this father of 3.
Just the way he explained it made me feel so comfortable.
And the date everyone has settled on is a significant one for Theo's daughter, Catherine.
It's your birthday. Aren't you lucky? But don't worry, we'll cut a cake in the hospital for you.
Yeah.
Okay? And then we'll celebrate after that. I get out as well, so, yeah. It's pretty daunting, you know, to have something like that in your chest. And it's probably been there for a long time.
To share the load, Theo's relying on his brother to help run their restaurant.
I missed out on a lot of work. George, you know, he's doing all the work for me at the moment, so, you know, I appreciate what he does for me, yeah. So, yeah, I can't wait to get back to work. What about you, Kathy?
I'm gonna miss you a lot.
You're gonna miss me a lot? Yeah? Cool.
Yeah.
Thank you. Give me my kid. Okay. Are you gonna miss me, eh?
In the small town of Warren, in regional New South Wales, young mum Jolene is battling a cancer that just won't go away.
Build a bridge, walk it.
Her latest operation at RPA is her 3rd. A 14-hour marathon to remove 3 smaller nodules and a massive tumour.
Getting that out is exactly what we were trying to do.
The surgery was so extensive, Jolene's abdomen needed to be completely reconstructed. With the surgical team happy with the result, Jolene started dreaming of going home to her little girls. But the following day, there's a big problem: unexplained bleeding, and her condition is deteriorating.
She's had quite a large volume out of her leg drain.
Okay, yeah, all right. Oh, yeah. Does that keep coming out?
Yeah, it's sort of continuous.
All thoughts Jolene has of going home vanish.
When you see complications, it does affect you. You have to stay strong for the patient and always be for them, be there for them, and have a plan. What's our next step? You know, we're going to be there to fix it up. We should call the plastics team and see what they think.
Yeah.
Her blood pressure is stable at the moment.
Our blood pressure is stable, supported on single strength noradrenaline.
Yeah. Okay. We'll see what the plastics team say.
The cause of the bleed is a mystery, so Dr. Lee is still weighing up whether more invasive surgery is necessary.
401 now.
In the past hour.
Now. Yeah, for sure.
So I agree.
Just got to find out what the source of bleeding is.
Yeah.
There might be some vessel that might be oozing blood. So if that's the case, then we'll have to take her back to theatre.
With concern growing, only minutes later, Dr. Lee makes that call.
Yeah, so the slight change of plan in the last 10 minutes.
Yeah.
So Dr. Lee thinks that we should just explore.
Okay.
So I've spoken to vascular. We'll get plastics on board and then we'll just take that.
Okay.
If you're worried, call me so that we can talk about take back.
Yeah,
Okay,
no problem.
thanks.
Hi, Jack. It's about the case from yesterday.
It's all hands on deck. Several different surgical teams are being pulled together for Jolene's urgent operation.
With complex surgery like Jolene's, we have to be vigilant and can't drop our guard. And things can deteriorate very quickly if we do, so we have to keep monitoring her very closely throughout her post-operative course, particularly in ICU.
We got 400 in an hour. That's way too much. So we have to take it for urgent surgery to see where the bleeding is coming from, whether it's coming from one of the ties on the vein or the artery, or if it's coming from the flap. But now I'll go and speak with theatres so that we can get Jolene into theatre as soon as possible.
With an unknown bleed, every minute counts. Cardiothoracic surgeon Dr. Kao isn't sugarcoating Theo's options ahead of his surgery.
Now, most surgeons in Australia will perform this operation by performing a sternotomy, a cut through the midline, and basically going through the skin and the bone and dividing your bone in half, and then spreading your bone apart and to get to the area they need to get to.
Okay.
I usually find it helpful, actually, when the patient's relative come with the patient to the consultation, because oftentimes when you're anxious or scared, you're not taking all the information in the first time round. When you have two people there, at least you can corroborate afterwards about what was said and discuss what are the options.
What I typically do for your kind of situation is I perform a minimally invasive robotic operation whereby I'll make 3 small cuts on the side of your chest. Each of these cuts will be the size of a pinky. It's about 8 millimeters. And we'll insert some ports into your chest, okay? Through these ports, I'm able to introduce a number of different instruments that I control to separate your lesion from the heart and the great vessels and the chest wall. Once we separate that, we'll make a slightly bigger cut and put that through into a bag and retrieve the bag and then send that away for analysis.
A lot of patients just want a little bit of time to allow the surgeon to hear their own personal concerns.
Robotically, I think, you be in hospital for 2 or 3 days, you take painkillers for 2 or 3 weeks, and you can get back to your physical activities in a much shorter period of time.
Okay.
Yeah.
Yeah, that'll be a lot better. Yeah, definitely, definitely.
It's a lot to take in, but Theo's breathless days could nearly be over.
Okay.
In the emergency department, 72-year-old John has arrived after being bitten by one of Australia's most notorious creatures, the funnel web.
Now he's really moving.
I was cleaning up some dead leaves down the backyard. All of a sudden, I felt this really sharp needle stab in your finger. And then all of a sudden, it stopped. But I just looked around and there was a spider probably 6 inches away.
It's a small spider bite. There's just a single puncture mark here. John's wife wrapped it up really soon, immediately after it happened. So probably not much of the venom had probably gone anywhere else. And potentially, if you wrap it up properly, it can just come out as well. And it's often very little. If John starts to show any signs of envenomation or becomes unstable, then we get the antivenom ready, and then we'd give them. Some of the things we look for are involuntary movement of muscle. We're monitoring for heartbeat as well, so there can be alterations to the rhythm. And sweating is another thing that happens quite a lot, or drooling. And then we monitor him for a couple of hours to make sure that he doesn't get any signs of envenomation. But we don't get it too often here, so it's a bit of a rare one for RPA.
John's brave wife also, somehow, managed to catch the offending spider.
We've taped it up tightly so it doesn't get around here. And what we do is compare it to a list of spiders that we've got here. And as you can see, it's sometimes hard to distinguish between different ones like trapdoor and funnel web.
I thought if I was going to get a reaction from the spider bite, I would have known well and truly by now.
As concerned staff keep a close eye on John, it's not just his welfare on people's minds.
You obviously can't just take it outside and put it there, but no one wants to kill the spider either, so there's a process going on, and then we'll work out what to do.
I'd like it to live.
But the jovial mood disappears as John suddenly experiences acute chest pain.
In your particular case, there is a nerve called the phrenic nerve, which I suspect will run close to, if not through, the lesion.
What's important is to make the patient, also their family, realize from day zero that you're on the same team, that I'm going to do everything I have in my power and experience and skill set to do the best job for them.
So I think there is a real chance that we may have to sacrifice this nerve to get the whole thing out in one piece. What the phrenic nerve does is that it controls the diaphragm, and it's basically a thin sheet of muscle between your chest and your tummy. And every time you breathe in and breathe out, this muscle is moving up and down, okay? Once the phrenic nerve, if it doesn't work anymore, then the diaphragm will be paralyzed and you can't breathe as well as before. Some people, it has a very minimal effect. Other people, they become a little bit more short of breath.
Okay. Right, that's a bit nerve-wracking.
I reviewed Jolene at around 7:30 this morning. She looked stable, she was comfortable, and she had good pulses in her left leg, good movement of the left leg. And then got a call at around 11 saying that there was been a significant change in the drainage and her hemoglobin had dropped. So we decided that she should come back to theatre.
Challenging moments, or the moments when things aren't going right, yes, it can be terrifying. It can be scary. So then you just got to go back to first principles, which we taught many, many years. Stop. Calm yourself, relax, get your team sorted, okay? Because I have to be the captain. I can't jump ship. I have to be the one that's steering it through the stormy path and get back into calmer waters.
We're looking for a bleed from where we had dissected or mobilised the vessels to see if any of those ties have fallen off. And we've also got the plastics team, so for two reasons, so that we wouldn't damage the flap that they worked so hard to create yesterday, and to make sure it's not bleeding from that also. And that's what we're about to look at now.
There's no active bleeding from the artery which we exposed yesterday, which is very, very encouraging. But that also explains why her leg is not too bad.
That's right.
We have found a little spot of ooze coming from one point over here.
And sometimes when we go in, we may not find the bleeding point because the clot has sealed it off. But we've seen some little points of bleeding here, but no major source of high volume bleeding.
Fortunately, it seems her blood loss is a result of a small and slow bleed, instead of anything catastrophic.
So we stopped all the bleeding. So there's some wall surfaces which was just oozing a tiny bit. Put some of the pressure on it. You know, we waited 3-5 minutes to stop it from bleeding, and it did. But the thing is, if we just left it alone, it could be okay. But in the daytime, she might have the same problem again.
As Jolene returns to intensive care, Dr. Lee and his team are confident things are back under control. But the next 24 hours are critical. Over 80,000 patients come through the doors of the RPA's emergency department every year.
Hello, you look like you're in a lot of pain.
25-year-old Ofer has just been rushed to ED after falling off a scaffold he was constructing.
You fell, how many metres do you reckon?
About 4.
Okay, and what's the surface like that you landed on?
Concrete.
Concrete, okay. With how far you've fallen and the fact that you're a bit sore down the bottom of your back there, I really do want us to lie you down. Can we help you? Do you want us to lift your leg up? You okay? Okay.
At this stage, doctors don't know how serious Ophir's injuries are.
We might wheel him round, yeah?
But what they do know is what happens in the first hour after any serious injury, known as the golden hour, determines any chance of recovery.
Okay.
Despite his crippling pain, Ophir is refusing any relief.
Is there a reason that you don't want the morphine? Is it that you don't like it, or because you don't have to be tough here? We know you're tough. You can have it.
I don't know. Doesn't the morphine make you go to sleep?
No, not that we won't give you so much you go to sleep. We just want to give you some so that you're not in such excruciating pain. We're not going to force it on you, but if you're really in a lot of pain, then okay. So do you remember the moment that you fell?
Yeah, misplaced my leg, and then went through the gap, and it went straight to the floor. Then after that, I just don't remember after that.
Okay.
Ophir has just become a new dad. And waiting outside and fearing the worst are his mum and dad.
You feel hopeless. All I think about my son falling from the building is something bad happened, because you see it in the news and a lot of young boys die. What do my grandson do without him? And he's too young to understand.
Part of a major fall like this is we do chest x-rays and pelvic x-rays just to make sure there's no major injuries that we need to do something about in a time critical sort of sense. I'm looking for any rib fractures or any signs of a punctured lung or any bleeding inside the chest. Because he's certainly got all this trauma to his left chest wall. That's the main thing I can see. So those x-rays look good, all right? I can't see any obvious major broken bones, broken ribs and things, okay?
But given his level of pain, emergency physician Sarah Vaughan knows the x-rays aren't telling the whole story.
What I'd like to do now is just do a quick ultrasound to look for any bleeding in your belly. The main thing for that I'm worried about is really all this bruising and pain that he's got around his left side of his chest and his left flank and back. And I guess the things that I'd be worried about would be rib fractures and injuries to the lung underneath where those rib fractures might be.
We're just going to pop a collar on you while we can.
Take a bit of a breath in for me. Breathe in for me and hold it there, yeah?
But as Ophir's examination progresses, his worsening pain is now unbearable.
Sorry.
It's the day of Theo's surgery.
Zip. The operating theatre's now.
The tumour in his chest needs to come out.
Okay. Bye.
But for Theo's wife, Jo, saying goodbye is proving very difficult.
I'll be right. Don't worry.
So a lot of people talk about the emotional and physical challenges that a surgeon might face during the operation. But to be honest, I don't really see it like that. I try not to think about who the patient is or who their relatives are. And, all these things don't really help me during the operation. All I'm doing is focusing on the series of tasks I need to perform.
Hey.
Hey.
How you going?
Good.
Welcome.
Thank you.
Bit nervous, are you? Gonna look after you, all right? That's that. All right?
Okay.
Feel it? Just give that a couple of minutes.
Yeah.
Just breathe easy, okay? We're gonna take good care of you.
Thank you.
You need to try and think about something nice that you're gonna have a lovely dream about, okay? How are you feeling now? Starting to feel a bit better? Yeah. I'm gonna start giving you some oxygen to breathe, okay? You're not going off to sleep yet. I'll tell you when you're going off to sleep.
I talk in my sleep.
You talk in your sleep. You won't be talking today.
Yeah.
Using this multi-million-dollar piece of equipment, Dr. Chris Theo will be performing revolutionary robotic surgery to remove the tumour.
We started doing operations that were never performed previously in Australia, minimally invasively, and with great patient outcomes.
And what we have here are 4 robotic arms. So at any time, I can place a number of different robotic instruments in one of these arms, and we can put 4 inside the patient's thoracic cavity at the same time, and do a number of different maneuvers in a refined fashion within the patient's chest.
Dr. Kao was the first Australian surgeon to ever be trained in robotic thoracic surgery.
What I do on the console is mimicked by the movements of the robotic arms. In Theo's case, obviously his lesion, first of all, is sizable, 7.5 centimeters. It's not a small lesion. And, we make sure that we stay away from the heart, which is separated from the tumor by only 1 millimeter or 2. And finally, the phrenic nerve, as I've mentioned, may need to be sacrificed, but we should be able to assess that from the beginning. Starting. Thank you. That's a tumor. Looking a bit bulky there, kind of what I expected. All right, we're good here. When you're ready, and take your time, we're ready to lower the bed and dock the robot. All right, robot's coming. Rachel? Yep. You're doing good. Yep. Fantastic. That's all right. Can you come in anymore? That's okay.
I think here at RPA, having the robot available in theatre is really like having a jet fighter. It's got a fantastic cutting-edge piece of equipment. But I think without the right pilot and the right support crew, you can't really make maximal use of that equipment.
Point the scope at the target anatomy, then press and hold the targeting button. Targeting complete.
All right. What you can see here is the left lung attached to the heart, which is pumping away underneath the pericardium. The phrenic nerve runs just over the course of the aorta over here and traverses down the side of the pericardium. And the lesion, or the tumor, I say, is just over here. You can see it's kind of very close to the phrenic nerve here. To me, it looks like it may not be involving the phrenic nerve. All right, I'm very happy with that. The robot's all set up now, so I'm moving on to the console to do the dissection aspect of the operation.
Robotic surgery is a little bit unique in the sense that you don't have any tactile feedback or you don't feel anything. What you control with the joysticks is entirely dependent on what you see. I know some kids out there watching this might think, playing computer games would be very helpful for this job that I do from day to day. And I have to be honest, it doesn't hurt to have that spatial awareness, whether that be playing sports or playing computer games. Just being aware of things in your peripheral vision and also the hand-eye coordination, those things are actually quite important.
What I think we should do, perhaps, is we can stay as close to the phrenic nerve as possible, try to preserve it if we can. If we sacrifice or damage the phrenic nerve, his left hemidiaphragm is not going to work and he's going to be short of breath, most likely, right? But at the same time, I want to respect the principle of taking all the tumor out if possible with clear margins.
But Dr. Kao hits a snag. Excess tissue around the tumour is creating complications. Back in emergency, John has been bitten by a deadly funnel web and has crushing chest pain.
Hello, Miss Graham. I'm Dave, one of the doctors.
Hi, Dave. How are you?
I'm good, but one of the nurses was saying you had some chest pain.
Oh, just a little bit of pain around there. I know what chest pain is. I've had 20 years ago, I suffered angina and ended up having a stent.
So anyone who's got a history of heart disease like you have, who has some chest discomfort, we tend to do tests on.
Yeah, okay.
So what we would normally do is do some blood tests to look at the heart, to make sure there hasn't been any damage to the heart arteries.
Mentions chest pain.
Yeah, that's the reason why people live so long now, so we look after their heart.
No, I don't have a problem with that.
Super.
John doesn't have long to wait to hear the results of his tests, and it's a massive relief.
So the blood test's all good. No rise in the troponin, which, as you know, is what we look for when you have some damage to the heart. So nothing like that happened. As for the spider bite, it looks like it didn't give you any venom, which we're very pleased about.
Yeah, I am too.
So go home.
Okay.
Just come back anytime you're worried, especially if you get pain in the chest again.
Thanks very much, Doctor. Okay.
Theo's operation to remove a large tumour from his chest is now in its 3rd hour.
I'm gonna try to undermine this a little bit more.
The groundbreaking robotic surgery is making good progress.
All right, so this is very good. We've dissected away the lesion in one piece, mind you. So I'm very happy with the extent of the excision. I'm happy in preserving all the major vessels intact. And now we're going to insert a bag and then put the specimen into the bag before retrieving it outside of the chest. All right, just focus on this last bit because I still trip up here, so we're gonna pay extra attention.
With Theo's operation, I'm really just focusing on each individual component of the procedure, being very wary about the danger zone of a particular structure as I'm working near it.
The reason for this bag is so that the tumor doesn't break off and, you know, little bits of tumor, if it disseminates into the chest cavity, that would be a bad thing to do. All right, let's just focus here and then get this specimen out of here.
Robotic surgery really is a bit of a team sport. The surgeon's on the console, but you require an assistant to also exchange instruments and for nurses to provide with the correct instrumentation. And so those things take time and takes experience.
I need you to open the mouth as I'm feeding you, okay? And then once I'm in, you're gonna tilt it a little bit better, but right now you can't do that, do you know what I mean?
Yeah.
Be really careful here, Anthony.
Yeah.
Do you know what I'm trying to say?
This is one of the final steps. It's a little bit unglamorous, just trying to put a specimen into the bag, but actually it can be one of the most tricky part of the operation, purely because there's not much space in the chest at the moment, and the specimen is quite large.
So much fat. Now, I've got to feed you a little bit more. That stuff is not going to close. And once again, it's because it's got so much fatty tissue. There we are. That's good, man. All right.
You want it there?
Yeah, hold on. Stop.
If this doesn't work, then I might have to make a bigger cut, spread the ribs apart, or even go through the front of the breastplate, something that I'll try to avoid, but I'll have to do it if I'm not able to retrieve the specimen successfully.
Okay, what I want you to do is like hug the chest walls to go upwards. I like that.
With no room for error, Theo's tumour needs to be slowly pushed into the bag.
I'll start closing and see how you go. Okay, hug towards the chest wall.
Yeah.
Give it a hard jiggle. All right, man, I like that. All right, hold on a second here. See if you can push that purple in gently, very slowly. You're doing good. Yeah, keep on pushing it in.
Yeah.
Keep on pushing it in. That's it, I like that.
Almost there.
Keep closing. Close. Close more, stop there.
With the job finally done, the moment arrives to get it out.
The lesion is intact in one large piece, and I feel like I can feel some normal surrounding tissue near it. The closest margin, like I said, was in the phrenic nerve area, but we're trying very hard here to have the best of both worlds, getting a clear margin as well as sparing the phrenic nerve.
Whilst the early signs are promising, Dr. Theo will only be sure when the pathology results come back.
Take a bit of a breath in for me. Okay.
Up until now, he's been refusing all pain relief, but not anymore.
You've changed your mind about morphine?
Yeah.
Okay.
X-rays and an ultrasound have returned some positive results.
I'm pretty satisfied that there's no significant punctures in his lungs, that he doesn't have what's called a pneumothorax, which is where there's a hole in the lung and the air accumulates outside of where the lung is.
But everyone's sweating on the results of Opha's scan that will reveal any damage to his spine.
So there's a few little breaks or cracks in the bones down the bottom of your spine. It's away from where your spinal cord and all the nerves go, and really the main thing is that it's just going to be a bit sore while it heals. But it will heal, and there's nothing in particular that to do just to manage your pain while that's getting better.
He's incredibly lucky, and as the news sinks in, his thoughts immediately go to his baby son.
You thought that you would never be like that. And after a week or two, you realise, oh, you got a son now.
And he's not the only parent thinking of their kids.
And now I'm smiling because the doctor told me he's still walking. He's a big teddy bear.
The trauma doctors, and I'm happy for you to go if you feel able to.
Oh, yeah, I'm just happy. At least I can go home and play with my child.
But before his release papers are stamped, Nurse Hannah Parkin has just one more simple thing she needs Ofer to do.
Do you want to see if you can sit up?
Yeah, I'll try.
Here. Give me your arm. Give me your arm. Good job. Good job.
No.
No? It's okay. It's okay.
Suddenly freedom
Too sore?
Way too sore.
feels a long way away.
That's all right. That's okay. He's not going to be able to get up.
Ofer is headed upstairs to the ward, where he'll spend the next few days recuperating before any decision is made if he can go home. It's been a week since Jolene's emergency operation to locate the source of some unexpected bleeding. And husband Craig has been at her bedside every day.
Big Mars kiss. I missed you over the weekend.
But today, Craig has more for Jolene than just a Mars kiss.
Hey, my baby. Hey. Oh, I missed you. Missed you too. Don't cry. My little superstar, hey? So proud of you. Hey, babe, princess. Good. Good? You right, darling? Yeah. Hit you hard a little bit unexpected, hey? Oh, so good to see and feel you, cuddle you though. Make me a world all better already.
It's felt like an eternity away from home for this mum of three.
You gonna give me some decent food?
And today, the surprises just keep coming.
Hey, my babies. Hello. Hey?
Go on the other side.
Oh, he's gonna have to lift them up.
Do you want me to pop the bed down for you?
Hello, honey. Selena.
Can't wait for you to come back.
Oh, I can't wait to come back. Name my girls. Hey? You right? And you have to be big and brave and get you yesterday. Your hair looks pretty. Hey? I got my three little girls to fight for, and I can't just lay down and let it beat me. I just got to put one foot in front of the other, and they make me stronger each day. Oh, but cuddles make me feel so good. You gonna come around this side, bub? That's it. Oh, Mum, just go to sleep for the rest of the day now. Don't move, okay?
After 5 hours in surgery, Dr. Theo has some comforting news that Theo's family are desperately waiting to hear.
Everything went quite well. We were able to achieve the goal of taking both the lesion out and also preserving the left phrenic nerve. All right, I know you guys were anxious and waiting a long time, but I really think I'm really happy with the result, and I'm expecting a great outcome for him. All right, you're welcome.
If you do a good job, you know, almost all the time, patients come out and have a great result, and that's really rewarding.
Hi, Jolene.
Hello, Dr.
Good morning.
Lewis.
Good morning.
Good morning. How are you?
After undergoing major surgery to remove multiple tumours in her pelvis, Jolene has only two things on her mind: the all-important pathology results and getting home to her three young daughters.
So I've got some good news today.
Yeah?
Pathology results are back, the preliminary ones. And as I said at the time of the surgery, we were happy with what we had removed. The margins were close, but all the margins are clear.
Yeah.
And so that bone margin is clear.
Yeah. So hopefully we got it then.
Yes.
And it ain't come back.
Well, that's the aim. And we had 4 of those smaller lesions within the abdomen as well. That's all been confirmed. And it was of the low-grade type, which is good news.
Yeah.
Okay.
Low grade and completely gone.
Yep.
It's been first time I've ever heard that one. Completely gone, but yeah, see how we go.
With all she's been through, Jolene doesn't allow herself to get too excited just yet.
Well done. Thank you very much, Doc.
My pleasure. It's
Thank you.
not just me, Paul Staley and the
Yeah, I
whole
know.
theatre team. And
It's just you now.
so, do you have any questions for me?
Will I be still doing chemo?
Because we had removed the tumours, there's no role for chemotherapy as yet.
You're right.
But we need to monitor you closely as you've been with Paul Staley.
Yeah.
So we'll do MRIs, we'll do PET scans on a regular basis
Yeah.
to look for any signs of
They're coming
recurrence.
back.
Yeah.
Mm-hmm.
So I know that does impact patients, that when we have to follow things through. But I think if we catch it early, if it does come back, then there are options.
Yeah, we're
And-
onto it.
Yeah, and chemotherapy can be an option later,
Yeah.
but not at the moment.
Yeah, right. So no radiation?
No radiation.
Cool, so just the op.
Yes.
Yeah, righto. Mm-hmm.
Okay.
Sounds good.
Okay.
Yeah,
All right.
very happy. Thank you.
I like your determination, and we're going to get you home soon.
Yes.
Okay.
Cool.
Excellent.
Thanks.
All right.
How soon?
Well, I just need the physiotherapist to assess you now.
Yeah.
Just have to strengthen the muscles that are left
Yeah.
and teach them to help you walk.
Walk, yeah.
Yeah.
And like you said, getting out of this bed at home is the first start of it.
Yes.
Once I'm home poking around, and no stopping me.
Okay. So that's our plan.
Yeah. No, thank you very much. Now I can bounce out of bed.
Excellent. And tell your family.
Yes. Yes. Don't make me cry.
Okay.
As Theo wakes up after surgery to remove a tumour in his chest, there's only one present his daughter Kathy wants for her birthday.
Hey, Cuckoo. Yeah, of course you can. There you go. Happy birthday. There you go. Hey, look.
Was it stars?
Yeah, good. Really good. I'm just sore, but I'm good.
The doctor said everything went really well. Got everything. Is he good and strong?
Oh. Yeah. I didn't even notice 6 o'clock. It was 6 o'clock. It was like 5 minutes. Give me a kiss, happy birthday. Right? 12. Wow. Inside, I was anxious. I was shaking. I was so, I don't know. It was just, the nerves overtook me. But, yeah, I'm just so happy. And, that was my probably most nerve-wracking thing, you know. So, yeah, I'm so happy. Yeah. Compared to what I was just a wreck. Yeah, so, yeah, no, it's good. Thumbs up, 100%. Yeah. So,
I missed you.
let me check up here.
We're waiting.
Okay. Hi, how are you?
Good to see you, good to see you. So how have you been going since going home?
Really good.
Fantastic.
Yeah, besides some serious pain.
Yeah.
Really good, yeah.
When we looked at the specimen during the operation or just after the operation, we measured to be, about 30 by 20 centimeters, so quite a large specimen. And the result is that it is a thymoma. So the thymoma, we mentioned this before, it's a tumor of the thymic gland. It's actually very uncommon in the general population, roughly about 1 in a million.
1 in a million?
Yeah. So it's good to know the confirmed diagnosis, but the most important thing for you is that the margins were clear.
Right.
And that's going to give you a very good prognosis, okay?
Right.
And as a bonus, the thymoma was right on top of the nerve. I think if we waited for another few weeks, it's quite possible we would have invaded the nerve. There's no way we could have spared it. So I think we got to the operation in the nick of time.
Right. That's great.
What's your take on everything? I know I've spoken a lot.
I'm just excited everything went well, and it shows me how lucky I am. We got in the right time. Unless we could have been having a different conversation.
I'd say it's the most satisfying part of my job, to be able to deliver the good news for the patients. It is just beyond words. I mean, it's the thing that drives us, right? I mean, I think most people in health do it because they love it. And I think being able to deliver this kind of news to patients with a good outcome is what keeps us going.
We're so happy.
Better than expected.
Yeah, way better.
Yeah.
Yeah, the recovery and, you know, I mean, sure, I'm in pain, but, you know, you could have been worse pain. And so, you know what? I'm a lucky man. Yeah.
And as for scaffolder Ofer, who fell 4 metres onto hard concrete, it turns out the best medicine for his recovery was rest. And 3 days later, he gets the all clear to go home. For Jolene, it's been a long 3 weeks since she arrived at RPA for life-saving cancer surgery. And today is the day she's been dreaming of.
Hello, my darling. I'm coming to break you out. Coming to break you out now. Get you out of here.
Righto, let's go.
Righto, Mum, let me catch up to you.
I'm running.
Waiting for her back at the family farm are 3 beautiful daughters and a new start at life.
Oh, the fresh air, lovely.
On the last day when we said goodbye to her and discharged from hospital, that smile and that happiness that she showed us, that's the biggest reward for me as a surgeon, is that I've cut out Jolene's cancer. She has the ability to walk, go back to her family and have a quality of life.
I'm gonna get in the car, I'm gonna drive, and I'm gonna wind the windows down, and I'm gonna turn the music up, and away I go.
My darling. Well, it's going to be great to have you home, Mum, I can tell you.
See yous.
Back in Warren, 6 hours drive northwest of Sydney, 3 beaming little faces
Hey, my baby.
tell the story. And with a lot of love from family and friends,
Ooh, you got cold cheeks.
life is slowly returning to normal.
He's been pretty strict on me this time, actually. Sit down, do as you're told, shut up, what do you want? He's waited on me hand and foot. Hey, babe. You know, I've been very looked after. Our friends have been cooking for us as well. Beautiful community, beautiful friends.
You can dribble it, Dad. You don't have to boot it.
Good to be home with my girls. I don't leave my girls. But the only time I have left my girl is for these operations. It's the longest time I have left my girls for the operations.
I think the biggest struggle was the kids missing Mum. And the biggest struggle was actually Mum missing the kids as well.
Very emotional.
But, you know, I reckon we're stronger for it. We're not going to let it beat us, that's for sure.
Back together again, going strong.
Yeah, all forward from here.
Mm-hmm.